6:30 Central each night, we like to take the time to take a closer look at the latest COVID-19 numbers for Arkansas. We've had a team tracking these numbers every single day since the pandemic started last March. Here are the numbers in today's update that we're paying close attention to. First, hospitalizations remain high. There are 1,371 people in the hospital with the virus. That's 31 more people than yesterday. Of those 1,300 hospitalizations, 460 are actually in an ICU bed. As of this afternoon, the State Health Department told TV 11 there are 43 ICU beds left available right now in Arkansas. We told you in the last half hour, 1,268 new cases were added since yesterday. So active cases, which means that's how many people are currently living with the virus in our state, over 25,000. Of course, if you don't get tested, you don't know you have it. So far this month, over 100,000 PCR tests have been taken. And nationally, nearly 30,000 people in the United States died from COVID-19 in the first 10 days of 2021. And as the virus continues to rage across the U.S., vaccination programs are struggling to keep up. Hundreds of older people in Florida waited in line for hours over the weekend, hoping there were enough shots for them. Hospitals across Arkansas are fighting COVID-19 on two fronts: treatment and vaccines. And several are actually taking part in the trials that make both possible. Arkansas Business's Lance Turner explains.
Arkansas health professionals are part of a key effort to keep the nation's healthcare system from being overrun by the COVID-19 pandemic. Clinical trials for COVID-19 vaccines and treatments are now underway at 2 Arkansas hospitals, and a third is distributing a new COVID-19 treatment. What's more, the hospitals predict that demand for this kind of work will dominate the landscape for at least the next few years. First, the vaccines. The University of Arkansas for Medical Sciences in Little Rock is conducting a trial for one developed by Janssen Pharmaceutical Companies, which of course is owned by Johnson & Johnson of New Brunswick, New Jersey. And Baptist Health of Little Rock is conducting a trial for another developed by Moderna. At Baptist, those efforts are led by Dr. Richard Pellegrino, who runs the Baptist Health Center for Clinical Research. In addition to its 2-year Moderna trial, Baptist has taken on 2 one-year trials sponsored by pharmaceutical company AstraZeneca. One of those began last month, and the other is set to start this month. Hundreds of people will participate in the trial, and about 35 Baptist employees will be working on them. The trials are funded by the federal government's Operation Warp Speed, which gives money to companies so that they can pay hospitals to conduct them. Elsewhere in Arkansas, Unity Health of Searcy is distributing a COVID-19 treatment that's been approved for emergency use. The new monoclonal antibody treatment, first issued the week of Thanksgiving, has helped more than 100 patients so far. Unity says the treatment has decreased their risk of severe outcome and hospitalization by a factor of 4. UAMS is also testing several new treatments, among them a drug by Asclepion Pharmaceuticals that aims to prevent COVID patients from being intubated. 60 people will be enrolled in that trial. Dr. Laura James is director of the Translational Research Institute at UAMS. She expects UAMS will conduct many more coronavirus-related trials during the next few years. And UAMS physicians are getting emails every day from pharmaceutical companies that want the hospital to test their COVID-19 drugs, ensuring that the work to defeat the virus will continue well into the future.